Hello, this is Jeff Swenson again, speaking to you from Salt Lake City. We'd like to discuss a little bit more about the ultrasound of the femoral nerve and how to perform a no-touch technique. Today we'd like to speak a little bit about ultrasound anatomy of the inguinal region and specifically the importance of transducer position. If we look at the right inguinal region, in order to get the characteristic view of the femoral nerve that we like, we have to position the transducer parallel to a line connecting the anterior superior iliac spine and the pubic tubercle. This is the 2 points connecting the inguinal ligament, and if we position the transducer on the medial third of this line, we get a very characteristic image if we press down firmly and change our angle caudad and cephalad until we get a view that looks like this. What we will see in this view is a triangular appearance of the femoral nerve. The most medial structure in this view will be the femoral vein. Lateral to the femoral vein, the femoral artery. Lateral and deep to the femoral artery, the femoral nerve. And the fascia iliaca, which is a confluence with the fascia lata laterally, as it passes medially, splits from the fascia lata and runs over the nerve but under the vessels, whereas the fascia lata passes over the vessels. If we look at this white line, there's a little more apparent. We can see laterally the green and white lines, the green line being the fascia iliaca, the white line being the fascia lata. The fascia lata passes over the vessels, fascia iliaca passes under the vessels. So if we advance our needle lateral to the nerve, we can use tissue movement to see where the nerve is medial to lateral on the screen, and we can use local anesthetic injection to see how deep our needle is. So as we advance our needle past the fascia iliaca, we'll get that characteristic distribution of local anesthetic over the nerve and deep to the vessels, or between the nerve and the iliopsoas muscle, but always deep to the vessel. So that's a very characteristic appearance. This is an actual ultrasound. If we look medially, we have the femoral nerve and the femoral artery. Our needle insertion point is a good bit lateral to the nerve. And you can see as we inject local anesthetic, our distribution of local anesthetic, we see two tissue planes that we're going to identify in just a moment. But the important thing to note here is that at the end of our injection, here's our femoral nerve, which is still attached to the iliopsoas muscle. But our local anesthetic has passed in a tissue plane that is deep to the femoral vessels. So you can see the outlines of the fascia iliaca here illustrated by the green arrows. The local anesthetic has passed over the iliopsoas muscle, over the femoral nerve, or superficial to the femoral nerve, but deep to the femoral vessels. Next, we'll see some more examples of this. Thanks.